Now, for more on this, we talked to Dr. Perry Halkitis, Dean of the Rutgers School of Public Health, and he devised the state's contact tracing program. Welcome back to the show, Dr. Halkitis.
Hello, Alex. How are you?
So should we be surprised that the governor or officials like him, anyone really, is still getting COVID?
We should be not surprised at all. Quite frankly, what we've seen over the course of the last few months is people returning to some sense of the way things were before, which means that they've gotten rid of their masks, they stopped socially distancing. Not everybody's vaccinated, not everybody's boosted. People are going to concerts. And the fact of the matter is we have, two strains of Omicron, BA1 and BA2, and now a recombinant strain that is a combination of 1 and 2 circulating all around us. And it's a highly transmissible virus. And what the governor said is right. I mean, people are going to continue to get infected. People are going to continue to get sick. And those who are vaccinated and boosted are going to work through it eventually.
Are we at a point, though, where it seems that we're going to stop blaming those who get COVID for not maintaining responsible behavior?
The blame game is always centered too much of our work these days into politics, unfortunately. Look, I am not blaming people. I will just speak for myself and say that I think everybody at this point in time has the tools that they need in order to prevent themselves from getting sick and from getting other people sick. And so it is my hope and my wish that everybody takes up those tools. If they choose not to, like the 40% who don't get a flu vaccine every year, that's their choice. The implications are going to be worse for them if they get sick and for their loved ones who are in their inner circle if they are vulnerable. The rest of us have a shield. It's called the vaccine, and it works, and it prevents us from getting really sick, and it prevents us from dying. And so we have the power in our hands to deal with the people who don't want to have the power in their hands.
What kind of metrics are we going to be looking at? Is there a specific number or point where COVID is formally an endemic versus a pandemic, and are we there yet?
Yeah, so, we're going to trickle there. Look, here's what's going to happen. We're going to enter the summer. We're going to be outside. We're going to be at the beach. We're going to be at picnics. We're not going to see so much transmission. And then the fall is going to come, and it's respiratory season again, just like with the flu. And we're going to see a decrease in the number of people who are fully vaccinated efficiently with boosters and stuff. And we're going to see a spike, in the fall with regard to new infections. To be at something that is endemic, we need to be at a point where it's not still thousands of deaths that we're seeing a day. We need to be down to a handful of deaths. So let's do a comparison. Every year, about 20 to 30,000 people die of flu complications. If we were to get to some place like that with COVID-19, we would be in an endemic situation. My hypothesis is that we'll probably see a little more than that just because we're continuing to learn about this virus and because variants continue to emerge. And so not quite yet, Alex.
Not quite yet. We're still waiting. Your work, you've done a lot of work on the spread or the path of HIV and AIDS. How does that, for you, inform where we will be going in the coming months and years?
Yeah, so I actually wrote something about this recently. When the AIDS epidemic first started, everybody was susceptible. It didn't differentiate race, socioeconomic status, ethnicity, what have you. Everyone was vulnerable, and it just spread wildly. And what happens with diseases, and you see this with many diseases, and just not infectious diseases, you see it with obesity, you see it with cardiovascular disease, it tends to lodge itself in those populations that are most vulnerable. Populations of color, populations with limited economic means, populations that are marginalized. So what do I expect to see to happen, especially now that the COVID money is running out and we're not going to refund it on the federal level, is that those who don't have means, who don't have access, who don't have the ability to actually go to the doctor whenever they want to go to the doctor, who are not going to have the money to get the vaccinations and the boosters that they need, are going to be the most vulnerable. And those are the ones who are going to suffer the most from this disease.
All right. Perry Halkitis, Dean of the Rutgers School of Public Health. Thanks as always for joining us.
Thank you, Alex. Good to be here.
As for you, stay with us.